So good afternoon. Thank you all for your attendance. Thank you for your patience with tech issues. My name is Heather Mackey, and I am the Senior Director for Cancer Prevention and Early Detection for the Prevent Cancer Foundation. We are so excited to have you joining us for our next session, where we will come together and talk a little bit, very briefly, about some of the key takeaways that we had from our breakout session. Each moderator will have roughly 1 to 2 minutes to very quickly share some of the group's key discussion topics. And while we know this isn't enough time to share all that was discussed, we hope that this will be able to provide some food for thought for all attendees moving forward. So let me pull up my screen so I make sure that I have the right person. I know that, as I said, with some challenges with logging in back and forth, we want to make sure that we have everybody on board. And I'd like to start with our group that was talking about lung cancer screening. So Maureen, if you wouldn't mind coming off of mute. I know that looking to see Maureen is here, and Mary Pasquinelli should be joining us shortly. So we'll start with Maureen. Maureen, can you share a little bit about some of the things that you talked about in your session?
Sure. We really covered a lot regarding the barriers, and then some interesting ideas. We have, when you look at the patient level, we have folks that aren't aware of that lung cancer screening exists. We've got folks that are maybe afraid to engage in screening. We have doctors who don't know the screening criteria and don't understand the shared decision-making process. We've got folks without insurance. We've got a whole lot of challenges, and some of the things that we talked about that are helping is working as a coalition, not just doing things on your own, partnering with other resources in the state, providing transportation, because that's a huge thing. We also talked about the Dear Provider letter that we used in the All Case project that helped people who were at risk adequately communicate with their PCP why they were there, and help them understand screening as well. So we really covered a lot of ground, but that education piece across the board is really key.
Absolutely. Education certainly is. Mary, welcome back. Thank you for your patience. If you wouldn't mind sharing just very quickly, maybe the key takeaway that you had from your group's discussion.
So looking at the barriers, mainly transportation, we talked about opportunities to overcome the transportation barriers. We're looking at patient education, going back to the provider with that education, again, the Dear Doctor letter. And I loved one of the colleagues from Kenya talking about sharing life experiences, lived experiences, and using survivors to talk to other people to get screened for any cancer. So kind of sharing to overcome the stigma and the fear about screening. So those are some of the takeaways that we had.
Yeah, very nice. Very nice. Thank you both. And thank you to those attendees for sharing. Next up, let's pull up Noel Larkin and Dr. Mandy Pratt-Chapman to talk a little bit about some of the pearls that they have in terms of their key takeaways from their session on LGBTQ plus cancer screening. Mandy, wonderful. Would you mind starting? Yep.
Sure, thanks. Wonderful. So we talked a little bit about some of the communities across the country where there have been some bans on inclusive imaging, such as banning LGBT or rainbow flags in schools, and kind of what we can focus on in terms of one person in our group shared a counter event that took place to show LGBT youth that they were supporting them. We also talked about focusing on social support and resiliency, focusing on what you have agency to kind of actively change and encourage for change, not kind of resting on inertia, and focusing on organ focused messaging and screening. No, I actually didn't even see you in there. I'm so sorry. So did you want to add anything? I feel so horrible.
No, he was in a different session, so you didn't miss
Oh,
anything.
okay. I was like, oh my God, I'm
No,
so
it's like, hey,
nervous.
it's
Okay,
me.
great. Okay.
No, I did a different one. Same topic. So I will say, yeah, we talked a lot about a lot of those issues. Something that was really interesting that came up initially, a couple people shared, is that just a lot of initial barriers to get people to even think about their own health and like being like, so like a youth focused culture, but also kind of fatalistic. Like people don't really see themselves growing older, you know, whether it's in the community, they don't see thriving older LGBTQ adults. So how to kind of like build in the mentality of getting preventative screenings from a younger age, making that be part of healthy aging for queer communities. Talked a little bit about that. We also talked again about language, the importance of naming, the importance of a visible welcome. We had quite a few people who were part of breast and cervical cancer prevention screening programs. We're talking about the work and outreach that they were doing around like changing logos, language outreach. And we talked a little bit about data too, and the importance of collecting sexual orientation and gender identity data and training at all levels, in healthcare settings. So, yeah.
One other, that's awesome, super complimentary to what we talked about. The other thing, we had a lot of people ask about how do we build trust in queer communities. And so we also talked a lot about going to where trust is already built. There are LGBT centers in many, many counties across the country. There are organizations that have been doing work and providing excellent services to queer communities for a long time. And so starting where trust is already built, rather than trying to kind of reinvent the wheel, I think is really critical when our communities have been excluded historically and not welcome, starting where trust is built.
Excellent points, excellent points. Thank you both for that. So moving next to Andy Dwyer and Kim Parham, who led a session on patient navigation. And I'm keeping our tech people on the fly because I'm changing it up in terms of who we're pulling up next. So it's all about resilience and flexibility, guys. So Kim, would you mind starting?
Absolutely. I'll go ahead and take it away. Our takeaways, the three main ones that we had were, it was really practical. For patient navigation or activation, I love that word, patient activation. Get creative when you're out in the community and show examples and take the mystery out of the testing. And an example was giving is using baby food to demonstrate how to properly perform an at-home stool-based test. And that came from the patient ambassador that is one of our community partners that presented. So that was, to me, a real good practical takeaway. The other is importance of education for everyone, the community navigators, and also for patients. There was, in the communication, there's a discrepancy. They were thinking colposcopy when it was colonoscopy. So just knowing the educational, how things sound similar and what they really mean and what they are. And then having people within the community that other people can identify with and feel comfortable with. And that kind of goes along with the building trust. And another note of that was a lot of times people have insurance, and getting the insurance on the call with the patient to confirm that the screening would be covered and there would be no out of cost to that patient. And let's see. I think that's pretty much, practical tips and things that are not medical jargon, like where do you park, the specifics of where you park if there's issues, little things like using certain patient types of wipes if you're doing a colon prep, things that are not really medical lingo, but it kind of humanizes and makes patients feel more comfortable and builds that trust. Andy,
Right.
take it away.
All right. So Kim, I do think the idea of partnership came up, particularly as it relates to barriers. So transportation, we had a really great and dynamic conversation also about translation interpretation services and how those are really garnered. Community partners, people who know the community, work with the community. How do you create those sort of opportunities and collaboration? I think you know, I hear this come up a lot. It's like, if you don't have this in your grant, if you're not sure how to build those, reaching out to the communities who speak the language, know the community in terms of fostering relationships and making sure that happens, that was huge. And one of the other things I think we spoke a good amount about was really thinking about COVID. Staff shortages and really thinking about capacity issues have come up in a bigger way. If they weren't already that before COVID, they're definitely it now. So being flexible to having these relationships with a different type, whether it's colorectal screening, GI groups, breast and cervical programs, and really paying attention to timeliness. I think we had a discussion about population health, and for people who are average risk, you know, there can be certain types of screening modalities, particularly for colorectal cancer, that are non-invasive. But if you do have high risk, you need to follow up on a positive. Timely follow-up is huge. And so we know that backlogs can be 9 months, a year. So really thinking about opening up that capacity and talking to patients about having the flexibility and options to be able to see providers who might not be in a neighborhood, might be in an adjoining county or the like, is something that we really need to be more open to. But with that comes some issues in terms of being, you know, a navigator and thinking about bowel prep or thinking about transportation. So we're really going to have to be facile with that creativity and those partnerships and really thinking about how that works. We did have a lot of discussion around cultural relevance and thinking about what the role of language and culture plays in terms of really thinking about access and making sure people are getting timely care and treatment. And so I think that's something that, whether it was for colorectal, for breast and cervical or other types of screening modalities, I really found it great in our conversation that we had some sharing about what practices and what's been effective in terms of thinking about managing patients and where they're at. And I think a strong theme came through is meeting patients where they are, leaving the door open, and really thinking of yourself as a trusted member who's there to navigate with the patient is great. I just have to share this. Pam and Lorraine shared about the work, and Pam closed out talking about how Cologuard sometimes is actually left on front porches, and what a surprise it can be for people who decide to steal packages. So I just want to remind everybody that there is some karma as it relates to people who do really dastardly things, even though the patient might have to actually supply another sample. I just got a really big kick out of that because there is a lot of levity when it comes to the work we do, a very human approach. And I think that we saw a lot of information and great impact sharing around navigation and what it means to really interface with patients. So thanks for the opportunity. It was a great breakout. Thank you all.
Thank you.
Awesome. So glad to hear. Thank you. Thank you. And finally, I'm going to turn things over to Alberta, Fin City. And I'm not sure if Melissa's back on yet or if we're still having some issues, but Alberta, if you wouldn't mind, we're going to bring you up here in just a moment to talk very briefly a little bit about your session on tailoring education and training resources to various communities to help reduce disparities.
Okay, the key takeaways in our work group was the inclusion of culture and traditions in health and medicine, and the value in meeting people where they are, especially when it comes to addressing culture and tradition, and when customizing efforts or intervention programs, messaging, and materials to the population that we serve, and then also to solicit input from community when developing programs and messaging and materials, especially at the state level of communities, because there may be a lot of diversity within the state or within communities that the materials need to be adapted for. So we can't assume that one fits all. And the other is to develop culturally appropriate for adaptation and appreciations needed to meet the needs around cancer screening, especially in underserved and underrepresented groups. And this will help with community engagement, relationship building, and empowerment. And then the other is to fund smaller organizations who employ community health workers that are deeply connected to the communities. The communities may actually feel very comfortable in reaching out to another local community member who they may establish trust with. And then to be able to adapt information to fit the needs of the community and population. And also, relationship building is really important in order to make connections to support the work to eliminate disparities. And so those are some of the things that were mentioned during our session. Back over to you.
Thank you. I think that relationship building is certainly something that I think rang true through many of the presentations. Melissa, and I apologize for tech issues. Melissa, I know just joined us back. So to put you completely on the spot, would you mind sharing just very briefly, maybe the top takeaway that you had from your conversation other than technology is maybe sometimes doesn't always behave the way we would want.
There were so many good conversations between our groups, and I apologize for not joining back in. Someone talked about, needing to diversify their staff. And I think about, right, again, my comparison is always like American Indians, we make up about 1% of the population. So I don't know that, right, can we always diversify, but how can we build allyship? And I know we didn't get into that, but that was a really good conversation. And I think just overall, the challenges that a lot of our communities face, whether, it's undocumented citizens, Black immigrants, American Indians, our transportation issues. I think there's just a lot as we think about tailoring resources.
Agreed. And thank you both very much for in terms of your leadership and your moderation. Thank you all for your valuable contributions.